If you start to see that, please call your pediatrician or come to your nearest emergency department. They should be evaluated by a doctor. Hi there, I'm Petey, the pediatrician, and today we're going to discuss a very important topic, which is RSV, or Respiratory Syncytial Virus. This is especially important for new parents, first-time parents, anyone who has a baby that's currently hospitalized with RSV, or anyone who just wants to learn more about it because it's very common. And at the end, we're going to go over a very cool thing. So let's get started. RSV, or Respiratory Syncytial Virus. Respiratory means that it affects our respiratory system. Our respiratory system, think of it like an upside-down tree. So you have your nose, your mouth, you take air in, and it goes into your trachea, which is like the trunk of a tree, and then down into some more pathways like the stems or the branches of a tree, and then it goes into these little leaves called the alveoli. And the way I like to explain lungs to children, which if you followed me for a while, I think it's the funniest question to ask, because you say, where's the heart? And they have some general idea, but you say, where are the lungs? Perplexed. No one knows where the lungs are, so I'm trying to do some education. I call them two big balloons, one on each side of your chest, and they take up space as you take in a deep breath. So that's the respiratory part. We're going to skip syncytial and come back to it. Virus means that it's just your common thing that can be transmitted between people through droplets or through contact. So it's that's why we say that videos went viral. I hope this video does too, because it's a really important topic. But virality, it gets around quickly because it's a virus versus a bacteria. Viruses we treat with something called supportive care. If the baby has a fever, we give them a fever, or someone has issues and needs extra oxygen, we give them oxygen, but there's no real treatment yet for most viruses. In my other video, we'll talk about flu and COVID and other things, but for RSV specifically, it's supportive care. So helping the baby make it through the virus and help managing symptoms for them. So the syncytial part is really cool because what happens is the virus links onto the cell membranes of the respiratory tract. So along your trachea, along the main bronchi or the bronchioles, those small branches, and it will cause the cells to fuse together, and those cells get heavy, and then they cause irritation. So the lungs will send mucus to the area and other things to help protect the lungs, and in doing so, these cells get really big and they warp with the mucus, and there's inflammation, and it causes these plugs in the lung airway. And because a lot of us can feel that and we feel really junky, we can cough on command, our babies don't yet have that skill. And so those little airways that for us get a little clogged, for them, not only are their airways even smaller, but they don't have the ability to cough on command or to clear all of that. So if you block an airway, you can no longer breathe through it, and that's why they are the ones who get most sick when they are infected with RSV. What we used to see pre-pandemic, before COVID, is a very classic story from the parents. The kid was fine, doc, for the first 2 days, some cough, some congestion, and then out of nowhere on day 3, he woke up swimming in a pool of his own mucus. And we heard that so much. RSV tends to get really bad on day 3 through day 5, just out of nowhere. But after COVID, I'm seeing it more now on days 5 through 7. So it's shifted a little bit, but the progression is typically the same. Okay for a couple of days, and then out of nowhere spirals into this huge mucus explosion in front of you. So the kids are breathing faster. How will they let you know if they're breathing faster? Well, these are the signs I want you to look out for. And I saw a lot of people online asking, when do I take my kid to the hospital if they have RSV? When should I be concerned? I'll let you know. So fevers are expected in viral infections. That's just a common thing. That's a sign that your body is working harder. It's like if you had a bunch of tabs open on your computer and it was just heating up a little bit, it's just letting us know you're trying to do a lot of things. We're doing a lot of things. We're occupied. We're fighting a battle against this virus. So fevers just let us know that the kid is fighting something. But if the fever is going on past 3 days, you should please let your pediatrician know, because most viruses typically get better within 3 to 5 days. The symptoms that typically happen is because the kid is congested, they have a lot of gurgly sounds, and then they can also have some irritability. They might spit up some of their food. But the main thing I want you to think about is because if the airway is blocked, then they can't get air in. So they're going to try to breathe harder. They're going to be breathing faster than 1 breath per second. They're going to start using their bellies to breathe. And then the third sign, which I'll put it up here so you could see it, we call it retractions. What's happening is that the lungs are trying so hard to pull air in, they're sort of becoming like a vacuum chamber, and they're using extra muscles above the clavicles, in front of the trachea. We call it tugging or retractions. They're trying to pull in extra air. You could see the outline of the rib cage underneath, in between, above, and around. If you start to see that, please call your pediatrician or come to your nearest emergency department. They should be evaluated by a doctor. They're likely going to do is evaluate your child, get a full history, do a physical exam, but the way to diagnose RSV is with a swab. We'll do a swab and let you know if the test result is positive for RSV. Now, it could be that the test is negative, but we still have a high suspicion for RSV because these tests are not perfect, and the test could be positive and we'll treat it like RSV, but there are other viruses like rhinovirus, which causes the common cold, and other viruses which also cause a buildup of mucus, but RSV is classic for showing up with a copious mucus production. So what can you do at home to make sure your baby is safe, especially when they're fighting RSV? What can we do to optimize them? Be mindful that what they're trying to do is they're trying to breathe, right? So through their nose or through their mouth into their respiratory tract. But if they're congested in their nose or their mouth, it's going to make it hard for them to breathe. So you have to suction the mucus out for them. You can get saline drops, put 5 drops in one, 5 drops in the other, wait a couple seconds, massage it around, and then suction it out. I'll put some links down below that will be helpful for you, but you want like a suction bulb, or some people have the automatic one that suctions it out. You want to be able to do that for them, again, because they can't cough on command and they have to be able to clear that mucus in some capacity. The other thing that you could do is called chest PT, or chest physiotherapy. You just roll your baby on their side and they love this. You lift their arm or go straight in the back, and I usually make a soft little fist, and it's different than the cupping motion, but it's a soft little fist, and you just give them some physiotherapy of their back. Both sides. You get it to the top, and what you're doing is you're dislodging all that mucus that was blocking that airway, and then they'll have the opportunity to either cough it up or swallow it, or it'll break itself up and get absorbed into the own tissue area. How frequently should you be suctioning? Well, it really depends. We don't want to do too much because we don't want to irritate the nose, but we typically say with every time the baby's about to feed. Why? Because what we find is if you don't suction them prior to a feed, then we're essentially doing this. If they're blocked through their nose, the only other way that they could breathe is through their mouth. But if we put a breast or a bottle over their mouth, we are functionally gagging them because they can't breathe from their mouth, and then they can't breathe from their nose because they're congested. And you're going to find that babies have poor feeding tolerance, or they're spitting up and vomiting up a lot. They could also be vomiting up because of virus causing vomiting or diarrhea, but if you're finding that the baby is congested prior to feeding, please suction them. Now, in the hospital, what we might also do is we're going to check the oxygen, we're going to check the fever. If they have a fever, you can give Tylenol if they're younger than 6 months. If they're over than 6 months and don't have any kidney issues, then they can also take Motrin. But you do that weight-based, talk to your pediatrician, or let me know down below if you want to know how to calculate how much Tylenol or Motrin your baby should be having, or acetaminophen and an ibuprofen for the more generic names of the medicines. And then also if we check their pulse ox, and we check to see if they are hypoxemic or they need a little bit extra oxygen to breathe. Again, all supportive things, managing the fever, giving oxygen. If they're dehydrated or spitting up and not able to tolerate, we give them some IV fluids. So really just supportive, because we're going to let the virus take its course over how many days? 3 to 5 or 5 to 7, just letting the baby fight the virus on their own. Now, some parents tell us, oh, I don't want my kid in daycare, or I don't want my kid to get sick. The good thing about having this virus, as frustrating and awful as it is that it's sort of immune training for them. It's training their body to say, I already fought RSV, the next time I see it, I shouldn't get as sick. We learned that RSV is one of the most common things that hospitalizes our kids. It affects their breathing, it affects their hospitalizations, tax dollars, but it also affects the families, and families having to take off from work and not being able to take the kid back to daycare because they're concerned about contagions. That's the other thing. If your kid is febrile or has a fever, which what is a true fever if you follow me on this channel? That's right, 100.4 degrees Fahrenheit or 38 degrees Celsius and higher, not 104. That's way too high. 100.4 and higher. If your child is having a true fever, they should not be, like, you should talk to your pediatrician, but typically the rule of thumb is to not let them be around other children because they're still contagious for the next 24 hours after a fever. And then also they should have within their system, if they're fighting a bacterial infection, which is a separate topic than a viral infection, but if they have a bacterial infection, like an ear infection or a throat infection, then they're on antibiotics, they should have at least 24 hours of antibiotics. That's a typical rule of thumb, but always talk to your pediatrician before deciding if your child can go back to school school and or daycare. So because we learned that this was having so many social implications and healthcare implications, and it was affecting so many people, this RSV, this respiratory syncytial virus, we came out with something super cool that I want to talk to you about, which is an immune training program for babies. It's so fascinating. So just like if your baby or someone had to go perform on stage on Broadway, but they've never had a vocal lesson or dance lesson in their life, they're gonna suck. Or if someone had to go play at the NBA, but they've never practiced before, they're gonna suck. Or someone has to go represent their country at the Olympics, but they've never practiced before, they're gonna suck. So we've learned in life that we have to prepare ourselves and practice before we do the thing that we're expected to do. So we've come up with immune training programs for all of us, especially our babies. We expose them to these little tiny pathogens, in this case the virus, in a small dose, and say, hey, this is what you might see later on in life. And so it gives them an opportunity to, fight it, duke it out if they have a functioning immune system. And so the next time that they see the full virus, they're like, oh yeah, I prepared for this. I did my lessons. I practiced. I went to rehearsal. I went to tryouts, and I was on the team, and we've done practice, and we've done all this stuff. My immune system is ready for this. Now, it's not saying that they won't get sick with RSV if they get the immune training program, but it is saying that they won't get hospitalized and won't die from RSV. It helps their body fight this even better, and we call it the RSV vaccine. Just like all other vaccines, they are immune training programs for our bodies to say, hey, I know that this thing can kill other babies, and it has, so we've come up with a way to show you a little bit about it so you can practice, you can rehearse, you can try it out before you see the real thing, so you perform at least a bit better than if you've never seen it before. Talk to your pediatrician about getting your baby the vaccine, and if you are pregnant, you can get the vaccine for yourself so your baby doesn't have to get the stick. It's so cool because you're passing your antibodies to your baby. Isn't that wonderful? You can refer to the newborn health video that I made, which is for new parents or first-time parents or anyone who really is interested in learning more about baby health and newborn health and infant health. And we talked about how when you breastfeed, you pass antibodies to the baby, but when you also get vaccinated, some of those antibodies can get passed to the baby as well, which is incredible. So that is RSV in a nutshell. I know there's probably some nuances that you're interested in. Please ask them down below, as well as some topics you want us to discuss. Thank you for watching. I hope this was helpful. If it was, please like it, share it with a friend, share it with a parent, share it with a loved one, share it with your baby, subscribe for more, and I'll see you in the next video, like this one, which is perfect for you. No, this one's you should totally, this one's really perfect. Click it right now. I feel like I should say something like, do you see me thinking? I've seen myself as I was editing, and I think it's wild.